to welcome you guys to our April edition of Inhale Life Asthma Conversations from the Chicago Asthma Consortium. Again, I'm your host, Sharmilee Nyenhuis. I'm a practicing asthma physician at U Chicago Medicine, and today I'd really like to have a warm welcome for our guest, who is Lisa Lombard, who's a licensed clinical psychologist. She has a Chicago-based practice and is also a part of SciPact, which allows her to practice in over 43 states with telehealth. And today we're going to be talking a little bit about mental health and asthma. I think this is a topic that comes up a lot when I'm talking to my patients. And so we're really excited to cover this topic. So first of all, Lisa, I was wondering, can you just tell me a little bit about yourself and why did you decide to become a psychologist?
Yeah, thank you. I have been a psychologist for many years now, and I think initially it was my intellectual curiosity about what makes people tick across the lifespan. I got my PhD at the University of Chicago, Human Development and Psychology, not a tip of the hat to U Chicago. And it was really about what stays the same and what changes across the lifespan for people and their personalities. But then I also knew that I wanted to help people. And so that was the clinical focus. Early in my career, I did a lot of work with people, children in particular, who had experienced trauma and abuse. And then there was also the importance of supporting people going through routine, everyday circumstances as they manage pain, stress, and anxiety. And so that is really where I am now in my work. And thinking about that, I think two very important goals stand out, which is how to help people feel better by helping them to access easy and simple and self-directed stress management skills that they can then apply to a variety of situations and circumstances that occur to them, because life is always throwing something at us. And the other important goal is that there's really a false division between the mind and the body. We call it, a mind-body connection, but we're one whole person walking around with a mind and a body. And so there are ways to feel better that might start with the mind or might start with the body or some interaction of the two of them. And so I think it's so important to remember that we're looking at how we are thinking about something, how we feel, what our sensations are, and what our behaviors are. And then when we make a change in any one of those domains, the others, by definition, will be impacted. So I think there's a lot of opportunity to help people without thinking about it as a strict mind-body division.
Yeah, I really like how you're kind of integrating them and really thinking it as one thing instead of putting them in different buckets because they both
Right.
influence each other. Um,
Absolutely.
yeah.
I agree.
Yeah, so with we're today kind of focusing a little bit on how mental health really impacts asthma and I've seen a lot of research, but also just experience that some people, don't know how does mental health actually can even impact asthma. So can anxiety and stress contribute to either the onset of asthma or making asthma worse itself?
Yeah, I think those are both true statements. That's correct. It's accurate that stress and high, big emotions can trigger, if you will, a flare up or an exacerbation of asthma. And having an asthma episode can be very stressful. And so we've got that circular pattern there, affecting the other. And it is very much the case that once one has had an asthmatic episode, there can be a lot more anxiety about future ones. So then we've got the addition of anxiety and the concern about future events. So that's where mental health practices that focus on stress management and tolerating a certain amount of anxiety. We're never going to be able to eliminate all anxiety, which is the sad news, the unfortunate news, but anxiety does serve a purpose. So keeping that in mind, we want the goal to be how to tolerate the anxiety in a way that's not detrimental. And so there are links, and I think that's coming out more and more in the research and in the clinical world.
And what are, maybe diving a little bit deeper, what are some of those mechanisms that that happen in the body that can link the stress to respiratory issues such as
Mhm.
asthma?
Yeah. So stress is a cascade of events that happen, which is going to lead to the production of more cortisol, more adrenaline. And those are two big factors that, as you're an expert in, that really drive asthma, right?
Yeah.
So, and the experience of it for an individual. So, chronic stress, as we know, impacts many, many systems in the body. And what it does ultimately is when a person has that chronic stress for too long. So if we think of the fight, flight, freeze response being on permanent, high alert instead of sort of just going on when there's a threat and then being able to lower. When it's on for too long, the body responds in a way where there's increased inflammation. And increased inflammation is really, really difficult for people who already have as the disease of asthma and the symptoms of constricted breathing and mucus production, and their whole immune system sort of already overly sensitive and overly sensitized. And so the stress keeps that on at a steady state when there isn't something to be stressful about.
Yeah. Okay. Yeah. Thanks for explaining that mechanism because it is something that, again, we hear about that flight or fight response, but I think it's typically supposed to just happen for short bursts of
That's
time.
right. That's
But
right.
but
As you're
yeah,
saying.
but in some people, when you're having chronic stress, whether it be due to having a chronic medical condition or, other things such as like job insecurity, food insecurity, housing
Yeah.
insecurity that
Mm-hmm.
can really
Mm-hmm.
cause chronic stress in your body, then is just in that fight mode all the time. Yeah.
Yes. Well
Yeah.
put. Mm-hmm.
Yeah. Yeah.
Yeah.
Now, one question I was just thinking as we were talking is about, you mentioned how, we definitely see how asthma and anxiety and stress are linked, especially, anxiety of having another asthma attack. But I'm wondering, do any of the patients that you see in general, do they actually have an awareness that, that their anxiety can be, triggering their
Yeah.
asthma?
Yeah. No, that is the a great question, and that's one of the goals of this kind of psychotherapy with people who are managing a chronic health condition is to help them get a better lay of the land of what are the influencers or triggers that might set something up where they're really going to experience some difficult symptoms. And then how to build in some preventative tools. So, stress management skills, although they're really helpful all the time, they're most helpful when they're used for prevention, right? For lowering that threshold so that a person is going around and despite some ongoing stressors of financial things and family things, their bucket isn't overflowing and then the asthma layers on top of it. Instead, they've managed these other stressors. And so if they can use stress management skills and be aware of what anxiety feels like even.
Yeah.
So one thing that's quite interesting is that sometimes anxiety gets mistaken for some other conditions because there's a lot of overlap.
Yeah, yeah, yeah. So I think kind of you're alluding, especially I think in respiratory conditions, you might feel like you can't breathe,
Right.
or you feel like, yeah. So those kinds of symptoms may be mistaken for asthma
That's
symptoms.
That's right, which really perpetuates the fear and the stress. And I call it the what ifs. So if you're seeing a patient or talking with someone and they're all about what if, what if, what if, what if this happens? What if I can't catch my breath? What if I'm out in the cold and this happens, or I'm away from my medication? Those are all things that are future oriented but haven't yet happened.
Hmm.
And those are anxious, worried thoughts.
Yeah.
And psychologists and mental health professionals have ways to help people kind of dial it down and reduce that chatter. And that's something separate from the justifiable concern and worry when there is difficulty breathing because
Yeah.
of that.
Yeah.
Yeah.
And I really love the example that you used with kind of the bucket. That's something that
Yeah.
I often use with my asthma patients because
Mm.
I always tell them, asthma is a disease of inflammation. So there's always going to be at least some swelling there or
Yeah.
inflammation there. But when you
Mhm.
add these other things, whether it be exposure to like an allergen that might cause more inflammation, that keeps, that
That's
raises
right.
the water level in the bucket. But then what you're saying too is that stress can also, especially chronic stress can also add to that inflammation, and then sometimes then, make things the water overflow on the bucket
Mhm.
and
Yeah,
cause like a big
that's
flare.
right.
So I really love that analogy and just really thinking again that it's not only just, again, exposure to allergens or if you have a cold or anything like that that can be
Mhm.
causing that
Um,
inflammation. It can be also this chronic stress that can contribute to that
That's right.
inflammation.
Yeah, I love that. And while you were talking, I was picturing, will there be a little spigot that we can open to take out some of that water, right?
I love that. Yeah.
And kind of restore a better equilibrium in there so it's not so full.
Yeah, yeah. Well, that
Mm.
kind of gets me to talk about, and I think you've mentioned this a couple times, our stress management. So we know that
Yeah,
stress is going to happen in our lives. It's a
yeah,
part of our lives. So it's
yeah,
not something that's going to ever, we're going to be 100% stress free. But I think what you're getting at is like, how do we manage it? How do we
right.
recognize it and how do we manage it? So how can you talk a little bit about how when you've encountered patients with a chronic disease, how have you incorporated stress management into them managing their disease?
Sure, absolutely. I think a good starting place is to talk about stress, just to even define it a little bit. The literature typically describes it as when a person when there's a challenge, it could be an external challenge or an internal challenge, but the challenge is greater than the person's resources. And again, those resources could be external, as you're saying, it could be financial, environmental, it could be family related matters, and also internal challenges. So, managing a chronic health condition has a lot of obvious, internal challenges. There's sensation, there's pain, discomfort, there might be sleeplessness, those things. So, let's see if there can be some resources that address that. Certainly, the fundamentals of getting good sleep. It's really hard to do anything well without proper sleep. So that's quite important. Nutrition, exercise and movement, and it doesn't have to be fancy exercise. It's just going out and moving a little bit, or while you're unloading the dishwasher, dance a little bit, or go up and down the stairs one extra time that day. Just keep it moving because we really know that that's important. Being outside in nature, we talk about with how important it is. We were built to be in the natural world, right? Our brains thrive on getting some amount of time out in nature. It doesn't have to be going far away on an exotic vacation. It's just appreciating that there's a little bit of sunlight today, for example, and you can get out there and do a few minutes out there. So all of those things that are basic and that we may take for granted, people aren't thinking always about how to put them back into their routines when they're busy and worried about their health, but they're really quite important. And then there's the actual practices that we do call mind body practices that will help to reset the central nervous system a little bit so it's not so exquisitely sensitive to the things that it's now sensitized to. So using mindfulness or regulated breathing practices, or learning self hypnosis, or doing yoga, or walking in a nature bath, that kind of thing. Those are all techniques that will help to manage the sympathetic nervous system and turn on the parasympathetic nervous system so that people are now not feeling that high fight, flight, freeze response. And the more that can be turned low and we can reset it, the more the body isn't going to so quickly respond with that cascade that leads to inflammation.
Yeah. Yeah, that's those are really important things. We know already that like a lot of the things that you talked about, like good nutrition and movement, those are very important in asthma. I feel like we haven't heard as much as like what you're talking about, those mindfulness techniques, and also
Yeah.
again getting some nature, or getting that. I wonder too if you have a little bit of advice, to some of our patients that um, may feel like they don't have, like, oh, how do I do mindfulness, or how do I practice mindfulness, that might
Mhm.
be not going to a spa,
Yeah.
or
No, I understand
yeah,
it. Yeah,
exactly.
that's a great question, and I absolutely want to boil it down to something that's accessible.
Yeah.
So mindfulness is about being fully present in the current moment. So again, we often have a lot of chatter going on in our heads, and we're thinking about what are we going to make for dinner tonight, and who's going to pick up the kids, and do I have to put the laundry away, and I have to finish my homework, and so on and so forth. But that's not being present in the current moment. So mindfulness is setting what we call an intention, and usually it could be an intention or deliberate decision to turn our attention to the cool air at the tip of your nose as you breathe in, and simply follow it and notice it. And I'll be very careful to say, especially with people with respiratory problems and disease, um, don't necessarily change your breathing, just notice it, right? Because we're not asking people to breathe more quickly or slowly or rapidly or in a pattern, although there are gazillions of those patterns out there that you can look at on the internet. This is really mindfulness where you just notice the cool air at the tip of your nose and you breathe it in, and then you allow it to flow through your body, almost like a stone dropping into the well of your body. And then if a person is able to blow out, to exhale through the mouth. And it's even better to pretend that you're blowing through a straw to make it a little bit longer and leaner of blowing out. And that is all for breathing. But the interesting thing is that most of us, when we do this once or twice, will notice our mind wanders and we go off to think about something else.
Yeah.
And that's the part with mindfulness of gently turning your attention back to your breath. You can say to yourself, like, I know my mind is going to wander. That's okay. Be really quite neutral about it. I'm simply going to notice the next breath I take in. And that returns your attention back to the present moment. And it's those little shifts like that which are really building up your muscle for doing this. Those are actually great opportunities to get better at being mindful. A lot of people will think of it as a failure, and I'm going to quit because I can't keep my attention on it. That's actually the opposite. Let that happen. It's going to happen. Be fully knowledgeable that will happen, and then use it to refocus again on the next breath. You can do the same thing with eating a raisin, popping a raisin in your mouth, mindful of all the sensations, the 5 factors of what might it feel like, what might it smell like, what do your taste buds notice about it. Before you put it in your mouth, look at the color, the size, feel the weight of it in your hand, and then let it rest in your mouth and begin to dissolve. And you can notice that you're probably producing a little bit more saliva now. And so you're going to notice all of the changes that take place before you even swallow it or chew it. And that's an example of mindful eating.
That's wonderful. Yeah, I mean, how often would you say that somebody should be kind of practicing some of those tools? It sounds, what you're kind of describing is that maybe like small doses. It doesn't have to
Yeah,
say like, oh, I'm going to spend 20 minutes doing mindfulness.
I agree with you. You're so correct. It is these small little doses, as you say, if and especially because you want to. It's better to do every day. The more you practice, the easier and more automatic it becomes. So that when there is something that's more urgent or emergency situation, you're going to know how to get right back to that calmer feeling. So if we practice this every day, I like to see people right after you brush your teeth, do a minute or two. So kind of link it up to something you're already doing, And I use the example of brushing a teeth fairly routinely and deliberately because we can say, well, why do you brush your teeth? And it's to stay healthy, to prevent cavities. You can never brush a cavity away. And so, same thing with some of the responses to stress, right? If someone says to you, oh, just relax or take a deep breath when you're already an anxious, panicked moment, it's not going to be as effective. So, sorry, I'm long-winded on this one. Do it every day. Do a minute. I think it's quite unbelievable when we hear people saying, "Yeah, I'm going for an hour of mindfulness meditation," or I'm gonna have a quiet. I'm not going to speak all day long, and I'm going to be meditating. That's not going to happen.
Yeah. Yeah. Yeah, I was gonna almost add in there, I like the idea of something you're doing routinely. And for again, our audience that might have asthma and is taking a medication every day, like that could
Brilliant.
be
Yeah.
a nice time to do it maybe after you take your medication, or
That's
even
right.
maybe while you're taking the medication, because we often talk about, making sure you're taking a cleansing breath before you inhale, and just maybe really, appreciating that sensation.
Yeah, no, that's a great suggestion. I love that a lot. And you bring up the point that some of these stress management and anxiety management skills are actually helpful for just helping support people while they take their medication, right? Either they have mixed feelings about it or uncertainties, or they've been forgetting. And so you can get a little bit more adherence, as you're saying, if you can pair it up like that. And if there are any kinds of injections, self-administered injections now, it can be really helpful to ease some of that needle fear that can come with that.
Yeah, yeah, that's a really great point too. Um, so, we talked a little bit about some of those like stress management techniques, and kind of like you said, how to incorporate it into your daily routine. It's again, doesn't need to be, a 15-minute session, or it can be, 30 seconds even, but practicing it even when you're not stressed, right? Just
Right. Yep.
so, yeah,
Mhm.
just so
Yeah.
we can get a better sense of what it feels like. And practice makes perfect, right? So
Yep.
yeah.
You make that progress with practice. It gets easier and easier the more you do it. You're right.
Yeah. And then, but how about if somebody is experiencing anxiety, and they're actively, I guess, experiencing
Yeah.
anxiety.
Yeah.
Is it just practicing those exact same techniques, or are there other suggestions that you might be able to provide?
For some people it's the same, but I would say that there are others. And one of the interesting things is, as we talked earlier, anxiety comes often with a shortness of breath. I can't catch my breath, or I have, butterflies in my stomach. I'm not quite sure what that means. So for many people, some other kinds of grounding exercises can be really helpful for anxiety. It could be taken very simply as asking a person or suggesting to someone that they really focus on how their feet feel right now. What are their feet touching? Are they touching the floor? Are you wearing socks and shoes? Can you feel the texture of those socks? Push your feet down onto the carpet and feel the pressure between the bottoms of your soles and the carpeting or your boots or whatever it is. And what you're doing is helping them really return their attention to something really fundamental instead of all the what if thoughts in their head and the scary experience of not being able to catch their breath or feeling a change in their respiration, and could be sweaty palms, or they feel flushed or whatever with anxiety. So instead, their feet are going to touch something, right? And that can be a really good grounding, and it's also a lovely metaphorical expression of you are safe, you're grounded here in the room or on the earth or in your home, and it's a nice way to get a person out of one of those more anxious states. Another grounding exercise is using all five senses. So it could be something like, think about three things that you can see, three things that you can hear, three things that you can smell around you, three things that you can taste if you were to open up your mouth, and three things that you can feel the textures. And then go to two things that you can see, two things that you can hear, two things that you can feel, so on. Then go to one And if you're still not feeling where you want to feel, you can start over. But you're really helping a person bring their focus into something that has some structure, unlike anxiety, which can be very free floating, and brings relief because they're not so bothered by some of these sensations then.
Yeah. Okay. Well, great. So I also just wanted to see, there's always new areas or emerging, mindfulness techniques or stress management techniques. So just wanted to get a sense, like, what areas or emerging trends are you most excited about in the field of asthma and mental health?
Yeah, great question. I hope overall it's that there's because of our better understanding of this mind body and that we're one whole person, and the relationship between mental health being all health, really, right? That there can be some non-pharmaceutical ways that are adjuncts to medications for people who have asthma, and that we can improve stress management and consequently reduce the both incidence and severity of a flare-up, and bring comfort. So bringing the comfort so that there's less fear going forward. I think that the natural world and the emphasis, as you were pointing out a little earlier, is kind of a growing area that people are really quite excited about. Playing outside when able is a huge factor for children to feel better. And we're seeing a lot of health benefits related to free play outside. I do a lot of work using clinical hypnosis, or what's called medical hypnosis, and teaching that to people so that there's a connection with some of the suggestions for, it could be for the airways to open up and use imagery that relates to inviting their bodies to make some changes that can ultimately help with symptom relief, so that the passages are not so constricted. And so we can use language and metaphor and images in a hypnotic experience when a person is more open to suggestion. I think the general quality of life factor of just letting people talk about the challenges, that can be huge. You listening to someone saying, well, it's not all about what medicine, but, I have to now factor in all of these things for my day-to-day life or for my child's day-to-day life. And that can be stressful. And so knowing the benefit of listening, I think, is really important too. And the stories that we almost tell, there's my last point is, if there's been a difficult situation or an emergency, if you retell it and it was terrible and traumatic and full of pain and tears, that's a different part of a family's life story than if you retell it and kind of find in there that went right. Asking people, like, how did you handle it? What went right? If you can find a little spot in there that did go well, or that everybody had a joke and laughed about something, that can be a great building block for future success. So I think the narrative story is also an area that's emerging.
Yeah, well, that's great. Those are really great points. So, well, I think we had a really great conversation. First of all, kind of learning how, stress, and anxiety can definitely, be, kind of hand in hand with asthma and other allergic diseases. But also learning about how to manage that stress and anxiety. I think this was really helpful and really interesting to hear about new directions for, managing, asthma and, along with mental health. And, I think, being a healthcare professional, I think it is something that more healthcare professionals, like asthma physicians and nurse practitioners, could definitely get a little bit more educated education on because I think, it is something often we're focused on, some of the medications or avoidance measures, but I don't think we really think about avoidance of stress. And again, that's probably not the right term because I think we're always going to be exposed to stress, but how to manage it. So I definitely, hope that, I learned a lot today, and I hope a lot of other, healthcare professionals can get that information and incorporate it into their practice.
Yeah,
Um,
no, that would be a great direction to go, and I'm really glad that that was one of the outcomes for you, that you would love to see other people in your field, and yeah, it's an important message. So thank you for hearing it.
yeah. Well, thank you again for being a part of our Inhale Life asthma conversations from the Chicago Asthma Consortium, and we will see everyone next month.
Thank you for the invitation. It's been a pleasure.